Hello, this is Robert Chen with Learn LODI, a free resource for learning how to market, treatment plan, place, and maintain locator overdenture implants. The purpose of this video is learning how to utilize cone beam CT scans beyond just treatment planning and actually translating your treatment plan into a CAD/CAM implant surgical guide. If you're new either to cone beam CT imaging or new to the concept of guided surgery, I'd recommend you start by viewing those videos first. They are both available on the Learn LODI channel and have laid down the pieces that we'll be connecting and building off of in this video today. There are a number of companies that will make CT guided stents for you, and many of them are excellent. Each system is different, and no single system is the best at everything and for every application. Regardless of which company you choose to partner with, it is important to fully understand the scanning requirements of your system before you begin. This will keep the process moving forward efficiently and also prevent having to expose your patients for multiple CT scans. At Reveal Diagnostics, we scan for a number of different surgical guide companies. As a scan center, our CT machines create DICOM images, and DICOM is a universal file language for CT scans similar to, say, a JPEG, which can be viewed by third-party software. So a CT machine with a high-quality sensor and a full field of view, we have the ability to scan for any guided surgery system. However, the way we scan the patient will be determined by the needs of each individual system, and today we'll be talking specifically about fully edentulous cases with the Anatomage guide system. And the fully edentulous cases require a little bit more consideration in preparation for the scan because of the absence of teeth. And the absence of teeth means we don't have a lot of good natural fiduciary markers. And we need these markers to be able to correlate additional pieces of data into our CT scan. So in addition to the CT scan, we'll have first a stone model and second a denture scan. And here's why we need each. So while CT scans are great, they alone are not often the best solution to have predictable fitting guides. And almost every guide company will use a stone model or an optical intraoral scan to create the fit of your guide, just because we can get much higher accuracy by using laser scanning tools. And merging the denture gives us full predictability over where the final prosthesis will go, and that allows us to fully visualize all of our results in advance in the treatment planning phase. So just to recap, we need 3 things in total to move forward with our cases, and one is the patient scan, and the second is a denture scan, and the third is a stone model. We'll start with the Green-Mousse scanning protocol. Dr. Michael Scherer has worked to develop this protocol, and it's extremely effective. It'll allow us to scan patients wearing their dentures without 1, having to drill the dentures and add radiopaque beads, or 2, mixing a messy and inconsistent barium lining to separate the surfaces. Each guide company will require some sort of fiduciary marker, and this protocol is simple, consistent, and produces less distracting scatter in your images. And it doesn't require your office to do a lot of work before seeing the CT scan and knowing if the patient is going to be a good candidate for implants. Here's how the process works. We have Green-Mousse here and a denture here, and we're going to show you how to line it, and it's a very simple process. The Green-Mousse has a 2-minute working time, 2-minute set time, so you can lay it in there, allow it to set, scan it, and remove it very easily. So very simple process to do. Here's an image of laying the Green-Mousse into the denture, spreading it out here, and then we're going to seat it in the patient's mouth, like that. When we remove it, you'll have a nice impression here on the intaglio surface. And again, this is a very even and consistent radiopaque surface, so it'll show up really nicely in the scan. Now, what we'll do is put it in the patient's mouth, scan the patient using all of the same soft tissue separation protocols that we used in our last video, but this now gives us the ability to add the denture in as an additional model. So we're going to do a dual scan protocol. So we're scanning this denture by itself as well. So that'll be a second scan. And then we will pour stone and create a stone model. So again, that's going to be 2 scans, one with the patient wearing the lined denture and one with the denture just by itself. So 2 scans, only 1 scan with the patient. Last time, we went through a virtual treatment planning session, and I'd like to continue from where we left off and discuss what we may have done differently had this been a case for guided surgery. In the last case, we scanned the patient wearing the denture and cotton rolls for good soft tissue separation between the denture here and the lips. And that allowed us to see the denture pretty well in the scan, and we see that outline right here. We'll be working up this case with Anatomage, a surgical guide company out of the Silicon Valley in California, and they have some additional tools to enhance the visualization and accuracy even further. So once Anatomage has finished merging those files, they will send it back to us through the website in one single planning file. So again, we will have our CT scan, and you can see that here. And then in addition, we will have the stone model. So Anatomage has taken our model and optically scanned it using a laser desktop scanner. So we're getting really high accuracy. This is on the micron level, and that's really important that we have a very accurate model, because that's where we're basing the fit off of the surgical guide itself. So we have that model here, and then we also have this image of the denture. And this denture was the scan that we took from the CT, and you can tell the CT data does do also a very, very good job of capturing all of this. And we're not actually using any of this data for the fabrication of the guide, but it's going to be a really useful tool for us to use in terms of our prosthetic planning. So let me bring everything back all together again. So we have that CT scan. We have that stone model that's just going to show us more definitively where the soft tissue is, and then also the denture, which again we could see in the patient scan itself, but this just takes it to the next level where it's going to make it very, very easy for us to use that in 3D space, off of which to do our implant plan. So let me show you just one more tool here. When we're creating our surgical guide, accuracy is a very important issue. And for this case, just for fun, we wanted to show you what it would look like with fiduciary markers, and that's what, or the radiopaque beads as fiduciary markers, and that's what we see here. And if we turn this model on and off, you can see how those line up with the actual denture and on the scan. So what a lot of companies will do is use that to individually line up these two pieces of data, and you can see it lines up here pretty well. Now the problem with that, aside from having to attach beads or drill holes in the denture to attach these beads, is you're only getting, in this case, 6 points of reference for us to line everything up. And what we found was that was just not as good as doing it using all of the data that we have and using all of the tools and the quality that we can achieve now with cone beam CT. So let me show you what we do, and this is kind of just on a conceptual level. For example, taking that stone model, and if we zoom out, it looks like a solid model, but zooming in, you're going to see we're really using all of these points, and we're creating what we call a wireframe mesh, and that's just creating a whole bunch of little polygons, and the software is automatically going to line up each and every one of those points. So we're getting tens of thousands of data points to match this stone model with this cone beam scan, and that gives us the highest statistical average for the best fitting guide that we can possibly get. And not only that, it's a really great tool for us to validate the accuracy of our diagnostic tools at hand. So how accurate are our impressions and our models that we're creating, and also how accurate is our CT machine. So when we go back into the implant tab, we can really see this outline here, this green outline, is what Anatomage is using to line up that denture. And if I change that, you'll see this green outline now with the stone model overlay. And now as we go through the scan, you can just go through mesial distal and just see how well does that line up. And if it's a really good fit, then you know, yes, all of my tools are well calibrated. We have good impressions and good models. And you can be pretty confident that the data you're presenting in Anatomage is going to be as accurate as possible, and we're going to get a really nicely fitting guide. So let me turn back on this denture wax up here, and we'll revisit our implant plan from where we left off last time. So the first thing we can do is, again, take a look at whether or not we have enough prosthetic space. So do we have that 9 to 11 millimeters that we need? And we can take that measurement, and we may have just less than enough. So a couple of options here. We can move this towards the buccal. We can move this implant individually. We can also adjust the angulation of the implant. And so we'll adjust that, and you'll notice we have all of these set to be parallel. So if I adjust the angle on this implant, they're all going to move together. And we can do it that way to give us the 9 to 11 millimeters that we need. So let's do that for 26. Let's check the space we have here on number 23. Good. And we'll go to number 21 here. Excellent. And finally to number 28. And looks like there's plenty of room here as well. Good. So everything looks nice. Now you'll notice all of that we could have done without this additional wax-up model. And what does the wax-up model give us? It helps a lot as well looking at the angulation of the implant with respect to the denture prosthetics. So ideally we want to see where the access will be, and also are these implants going to be perpendicular to the occlusal plane? So we tipped it a little bit towards the buccal to give us a little bit more restorative space, but now you can see the angulation of these implants is a little bit anterior. So if we were just to move it a little bit back, can we get a little bit better angle and occlusal forces across those implants? And we may just see how much we can get. And we're probably going to have to balance here in between what angle we would like to have versus how centered are we going to be on the ridge here. So let's just go through each of these implants again and make sure that we have as much space as we need. So number 26, we have just about 9 there. Maybe we'll move it just a little, and we can have a little bit more space. That looks good. We'll do here number 23. A little bit short here, so I'm going to move this implant just a little bit to the buccal. And we'll see if I can just grab a little bit of extra space. And that puts us at right about 9. And then let's go here to number 21. And we'll double check 21 to see if it has, and yes, that is enough space for number 21. And finally, let's check number 28, and it looks like there's a lot of room here on number 28. So, looks like we're good. We have enough prosthetic space to restore, and then also now taking a look at the angle of these implants, and that's lined up much more nicely. So that's going to be a much better solution for us in the long term. So from here, we can say, yes, our implant plan is pretty much done. So the next consideration is, what are we going to do to make this doable for guided surgery? So from here, I will turn off this waxed up model and turn back on the lower stone model. And again, this is what we can expect the guide to be made off of, so it'll be made to fit this. Now, one of the issues with guided surgery on a fully edentulous mandible like this is there are no teeth to hold that guide in place. You don't have any good retention. So one way to resolve that is by adding anchor pins. And I will add 2 anchor pins here. And I'll just throw these in, and you can see what they look like. And we'll just place these like so. Now, these are just, they're small 2mm pins, and they go just the tip into the bone, and that'll give us enough stability so that the guide, when you seat it, isn't going to be rocking and doesn't need to have a whole lot of engagement, just because the guide will be resting mostly on the soft tissue. So this is really just, we're going to get a little bit of additional stability here from these pins. So that looks about right. In the mandible, we'll typically plan between 2 and 4 or 3 and 4 in the maxilla. It's not going to be too much of a restrictor here. In this case, we have plenty of bone. Looks like we have a really nice clean scan and model. It lines up well. We're not going to have too much problem. So we're just going to plan 2 in this case. So now we have everything in place to give Anatomage the tools they need to know how to make our surgical guide. So there are a couple of things we can do just to help make sure that they don't run into production problems on their end. The first is going to be using this check sleeve button here. And we can choose what instrument system we are using. And in this case, we're going to be using the Anatomage guide system with handles and wide sleeves, and we'll click on check interference, and I'll show you what that means in a quick minute. So it looks like we have a sleeve impaction here, and what I'll do is click change implant planning so we can go back and review what this looks like. So just as when we're planning for the denture, we can't have these implants too close together. The same is true with the surgical guide. So if these sleeves, when they create the guide, they embed these sleeves, and if they are too close together and we won't have access, that can be a restriction. So in this case, these little red collision indicators are telling us where we're having issues, and we can see what that looks like in the 2D as well. So in some of these cases, it'll just be the sleeve is impacting the soft tissue, and it may or may not be an issue with seating. If we're doing a tissue punch, for example, not going to be an issue when we seat that guide. On this one here with number 23, it looks like the sleeve might impact the bone, so we may need to pull it a little bit more again towards the buccal and crestal here, just so that we can clear that space and they'll be able to fit that sleeve there. So a couple of considerations. Not the end of the world if we don't check this. Your anatomage technician, or if you're working through Reveal Diagnostics, we will coordinate and make sure that all of this looks good for you. But if a problem were to come around, we would just need to revisit this and tweak our implant plan a little bit, or just tweak the way we're approaching our surgical plan for this case. So a little bit about how we would integrate the surgical guide on the day of surgery. When they send the guide, it will have 4 sleeves in it here for each of the implants, and then 2 for the anchor pins. Now, these sleeves are going to be 5.1 millimeters in diameter, and what we'll do is use inserts for each of these, and those inserts will be matched to our depth sleeves with the Zest LODI implant system. So the nice thing about how this works is you don't need to purchase a whole new system of drills and sleeves. We've made it pretty simple for you, so you'll just get a few pieces and you can just insert it directly into this guide, and it'll work with the existing kit that you already have for your Zest LODI system. So that way, whether you're doing it guided or not guided, there's not a whole lot of additional investment in pieces that you may not use every day. And it just keeps inventory a little bit simpler. We like that a lot. With that, when you get everything back, Anatomage will send you a surgical guide. They will send you a printed model. So they will actually print this and ship it out to you, which is nice. And the last thing you'll get is a reference chart, and that chart will tell you a list of the implants that we've chosen and what diameter and what length that we're using for each site. So really nice tool. It makes the whole process a lot simpler. All of your planning can be done before the day of surgery, and then on the day of surgery we have everything. We know where we're going, and we have all of the information for what to expect, and it can just be very smooth. My recommendation is, once you get the surgical guide in your office, check to make sure everything looks good. Seat it on the stone model, make sure the fit is good, just to verify for yourself. And if it's your first case, you can just practice drilling. Drill straight through the guide using the model. Get a feel for what that process is like, switching out instruments, because it is, if you've never done it, a little bit of a different process. Not difficult, but we definitely want everything to be as smooth as possible for the day of surgery. So that pretty much gives us the A to Z for our guided implant surgery. And if you've watched this video, our implant planning video, and Dr. Scher's guided implant surgical technique video, thanks for sticking with us through the entire process. I think it's a couple of additional steps over and above what you may normally do without CT and without guided surgery, but I think you'll appreciate the added benefits, the predictability, the better overall outcome, and just the much shorter chair time for each of these cases. So we can kind of do our homework in advance and be really prepared for the day of surgery. Now, once you get the hang of the process, I think it's definitely much easier, and for a lot of people just becomes second nature. As you're first getting started out, feel free to use me use Reveal Diagnostics as a tool to learn the process. We partner with Anatomage and can offer help and treatment planning with your surgical guides, and so we'll help facilitate that process to help you do and get started with your guided surgery. If you're in the San Francisco Bay Area, I would encourage you to send patients to us, and that way we can facilitate that entire process from pre-scanning considerations to actually doing the scan, doing the denture scan, lining it with Green-Mousse, and doing all of the software, uploading to Anatomage and treatment planning for you. So really all you need to say to us is, here's a patient with a denture and a stone model. Help me create that guide. So we will work through that entire process and meet with you just to say, hey, this is what we've put together. Have you just check through each of these implants, and we go through that, make sure it's what you like and is going to work for you, and then we just order that guide and everything arrives at your door for the day of surgery. So really elegant process. Our goal is just to make it as simple as it can possibly be, and hopefully get this technique and some of these tools out to more people who may just not know about it, or maybe a little bit intimidated by starting on something that's seemingly very complex. So I'd encourage you to try it out, or at least explore some of your options. You can feel free to give us a call at Reveal Diagnostics or any guide company, scan center that's local to you. Whichever way you choose to do it, there's a lot of good resources out there. So please take advantage of them and let us know how we can help. Thanks a lot. Thanks for joining us.